Hello, viewers. Um, Welcome to Excel Health Arena, and we will be talking about intrauterine device or devices, intrauterine devices, or intrauterine contraceptive devices. These are devices that are inserted into the womb, into the uterus, to prevent fertilization or pregnancy. They are devices, they are inserted into the womb from the VJ, inserted into the womb, and they stay there. And the way they work is that, one, their presence somehow prevents movement of sperm into the fallopian tube to fertilize eggs. Two, some of them, there are different types. Some of them contain substances that, when released, are toxic to the sperm, and so in a way they destroy the sperm. And once the sperm is destroyed, it cannot move to the fallopian tubes to fertilize the eggs. So they can be in the womb for between 3 and 10 years. They can be effective. So they are quite effective. When it comes to effectiveness rates, intrauterine devices are about 99% effective. Very, very effective. So there are different types, and I want to grade them or group them into 3 generations, into 3 groups: the first generation, second generation, and the third generation. So the first generation is the type of device that is inserted into the womb but does not contain anything that it releases into the uterus or the womb that destroys sperms. Those group, or that group of intrauterine devices, does not contain anything. They're just plastics. For example, there is what we call Lippis loop. One of them is Lippis loop. Lippis loop is a plastic coil, is a plastic device, spiral in nature, and it is inserted into the uterus. The way it is stationed in the uterus, it is positioned in a way that it does not also allow sperm to move into the fallopian tubes, up the uterus into the fallopian tubes, for it to be able to fertilize the egg. So in a way, it does not allow pregnancy to occur. So there are also the second generation type, is the one that has copper. It is usually T-shaped and it has copper. So we call it copper T. Usually copper T. It's a common word, it's a common name. Copper T is for the second generation intrauterine device. It is also inserted into the uterus, and the way it is inserted, it's a procedure. It's about a few minutes procedure for us to insert that into the uterus. And when it is discharged into the uterus, the wings, the two ends of the T, they spread out and point towards each fallopian tube to tactically block the fallopian tubes, thus stopping sperm from moving through the fallopian tubes to go and fertilize the egg. They do that. And another thing is that it contains copper. So copper is a material, is a substance that is toxic to sperm. And so when it's once inserted, in about 7 days after insertion, it is expected to be absolutely effective, almost 100% effective, such that when inserted 7 days after insertion, a woman is good to go to have sexual intercourse. Even if she ovulates, she is most likely not going to get pregnant, because the tubes are already blocked. Even when the tubes are not completely blocked, it also releases copper. So this copper is a substance that is toxic to sperm and does not allow sperm to, destroys the sperm. So it is either it stops sperm from moving towards the tubes or destroys the sperm. Either of the two. It works in that way and it prevents pregnancy. And the third generation is another one that does not contain copper but hormones. It contains hormones. So hormone levonorgestrel is the substance that is contained in the third generation intrauterine device. It is usually referred to as Mirena coil. It's a Mirena coil by name, and so it contains levonorgestrel hormone, which is also released into the uterus. And when that happens, it destroys the sperm. It doesn't allow the sperm to move. It doesn't allow the sperm to find its way into the fallopian tubes to go and fertilize the egg. So the side effects, if we look at the second generation, the side effects, because there could be increased, or let me start by saying that there is expected to be pain. During insertion, there may be slight pain, and after insertion for some time, there may be pain. For days, there may be pain before the woman gets used to it. The body gets used to it over time, adjusts to it, such that the woman does not even feel that she has anything in there again. So she gets used to it and she doesn't feel the pain again. So there can be pain, one. Two, there can be bleeding. Even when the woman is not expected to menstruate, bleeding can occur. There could be some blood. And after some time, because it is a foreign body that is inserted into the body of a woman, of a living being, there is bound to be some, reactions to it. Just like you have something new in your body, you would probably react to it. And it doesn't it doesn't occur in every woman. Okay, so when that happens, when it is inserted, there could be bleeding. I've talked about pain. There could be bleeding. Then sometimes the bleeding could be heavy to the extent that it causes anemia. So anemia could eventually be a side effect. The bleeding, apart from occasional bleeding, it could also increase the quantity of blood that is lost during menstrual flow. So it increases menstrual period. There could also be spotting in between menstrual periods, or in between the menstrual cycle. There could be spotting. There could be vaginal discharge. There could be a little bit of pain during sex. But like I said, over time, the woman gets used to it, and all those things do not occur any longer, sort of. So the ones that contain hormones, the third generation IUDs or IUCDs that contain hormone. For example, I said Mirena coil. So the side effects, inclusive of the ones we have talked about before, other side effects in addition to the previous the side effects for the second generation ones, is there could be breast cancer. There is risk of breast cancer. There is risk of breast tenderness, headaches. There could be nausea. Then mood changes. Then sometimes there could be weight gain, because this has to do with hormones. So hormones are released, and once that happens, hormones will have effect in the bloodstream, because they go into the bloodstream. So don't forget, we've talked about hormonal methods. So those things that happen as side effects in hormonal methods are likely to still occur in third generation intrauterine devices that contain hormones. So the mechanism of action, usually when they are inserted into the uterus, they cause a form of inflammation in the uterus. Like I said, they are foreign bodies. So because they are foreign bodies, when they get into the uterus, it will make the uterus feel somehow. And in a way, because it feels strange to the body, the body, the uterus reacts to it in a way that it's inflamed. The uterus is inflamed at the end of the day, and it attacks the white blood cells. It